Alright, I'd like to start off the Exam 3 review. Exam 3 is going to be a 100-question multiple choice, just like your previous two exams. It'll be held on Friday, the 30th of November at 1 o'clock in our normal classroom. I've been assured that the PAR test online is now working, so we should get immediate results and not have any more problems with that. Just to get into the meat of it, going over to your high-risk OB, obviously you need to be very familiar with the anatomy with the gravid mother, be able to do the maternal assessments, membranes intact, cervical dilation, effacement, and station, understand what all those are referring to and how each progresses. Fetal monitoring, you need to be able to know what normal is to determine what's tachycardia and bradycardia in the fetus in relationship on the fetal monitoring with the contraction in the relationship with the fetal heart rate, know what accelerations are, decelerations, both early, late, and variable, understand what variability is. And then, of course, all the signs, or I should say, the significance of the different types of accelerations and decelerations, what they represent. And then also, of course, moving into the treatment of those conditions to include, positioning and tocolysis, fluids, and in regard to tocolysis, you need to know what the magnesium and terpinolene doses are. Postpartum hemorrhage, what you can do to treat patients suffering some severe postpartum hemorrhages. Of course, your normal paramedic stuff, being familiar with placenta previa, placenta abruption and rupture, signs and symptoms, and what treatments you can do. Moving more to critical care, the preeclampsia, eclampsia, HELP syndrome, you need to be familiar with all those and what treatments that you need to do and precautions you need to take as a critical care paramedic. Moving into trauma, you need to be familiar with the general trauma system setup, the different level of trauma centers and what their general criteria is. Need to review Newton's laws of motions. I don't think it's in the textbook. You may have to do an online search, but you need to be familiar with Newton's laws of motions, first, second, and third laws. Head injuries. Certainly know the different types of hemorrhages. Certainly be familiar with Cushing's triad and how it progresses. Intracranial hemorrhages, signs and symptoms. Be able to know what a normal ICP reading is and certainly what abnormal is. Being able to calculate what the cerebral perfusion pressure is by knowing the ICP and the MAP, and then what treatments that you can actually do to minimize morbidity and mortality associated with head injuries and increased intracranial pressures. You need to be somewhat familiar with the cranial nerves. You don't need to know any of the actual nerves, but you should be kind of familiar with the cranial nerves and where they're located. Being able to calculate GCS and RTS and what the significant values are. Certainly you learned, GCS less than 8 and we need to intubate. But as far as their values in relationship on where you transport the patient to. And moving into thoracic trauma and abdominal trauma for that matter, as well as pelvic, you need to be familiar with all the different traumatic conditions associated with those types of injuries, the signs and symptoms, complications, and certainly how to treat those patients. Review your chest tube insertion and also how you need to handle the pleurovac and facial fractures, you need to be familiar with the different classification of facial fractures and orbit fractures. Spinal fractures, specifically, be familiar with the Hangman and the Jefferson fractures, what they indicate. Splenic lacerations and liver lacs, there are different grades. Be familiar with those. And then the different signs associated with abdominal injury, Cullen's, Gray-Turner's, and Kerr's signs. You need to be familiar with all of those. Pediatric neo, you certainly need to be familiar with pediatric vital signs, how peds and more so neos generate cardiac output, pediatric shock associated with blood pressure. You need to have a good understanding of signs and symptoms and things to look for, and how pediatric patients differ than adult patients in relates to shock. You need to review all the pediatric trauma statistics, such as what's likely to be injured, what's leading causes of death, and that sort of thing associated with pediatric trauma. Pediatric respiratory, be familiar with the RSV and bronchitis and the respiratory conditions that are commonly seen with peds and how we treat them. Moving on to the neonatal, we talk about special delivery conditions, especially talking about meconium staying babies, how we use meconium aspirator and that procedure. You need to know some of the anatomical differences that occur in the first few breaths in the neonate. We need to be able to calculate APGARs, know when we're supposed to get the APGARs, and also be very familiar with the neonatal resuscitation. We talk about the triangle and the neonatal resuscitation. And then in general, we need to be very familiar with neonatal heart rate as it relates to hypoxia, which is really unique. For tox and infection control, we need to know all the routes of transmission for the big infectious diseases that we're talking about. We need to know what agency is responsible for establishing guidelines. Need to be familiar with meningitis, hepatitis, the flu, and tuberculosis. Moving on the tox side, definitely need to talk about or review the ethylene glycol overdose. They always like to throw those exam questions in there, as well as the organophosphate poisonings. Definitely be familiar with those. Also, read that section regarding the street drug section. There's some information there you might see again. And lastly, we're going to talk about burns. You need to know the pathophysiology with burn trauma. You need to be able to calculate the percent body surface area, identify what determines it to be a critical burn. You have to use the Parkland burn formula. You need to know what some of the goals are for fluid resuscitation, and also especially considering compartmental syndrome associated with circumferential burns or electrical burns, signs and symptoms of compartment syndrome, and how we can treat it. I think that is about all I have for the review. As always, you can email me or call me with any questions you might have. I apologize for getting this review out a little bit late, but otherwise I will see you guys on Friday at 1 o'clock. After the exam, we'll talk about the final exam. Thanks, and have a good day.